Are you thinking about becoming a nurse, but not sure what nursing actually looks like? Well, you're in luck because I asked real nurses for the truth about their nursing careers. Who am I here with today?
Hi, I'm Annabelle Kline.
Hi. Um, so you're a neuro ICU nurse, right?
Yeah, so I'm a neuro ICU nurse. I started in my position in July of 2024 as a new grad, and I
Mhm.
completed their nurse residency. I was a clinical one nurse, which is like the new grad position there for a year. And then after I graduated residency, which is about 15 months, then I became a clinical two nurse. So now I'm a clinical two nurse in the neuro ICU.
Oh, cool.
Yeah.
Wait, that's really cool. So was it a new grad out of your undergrad or grad
Yeah,
training?
so I went to Temple for nursing for undergrad and then graduated in May and then I was interviewing at the end of school between May and June and then I got the position and then I started residency and my position in July.
Cool. Yeah.
Yeah.
So what specifically drew you to neuro ICU rather than other critical care specialties?
Absolutely. So when I was in my um externship during school and clinical rotations, I was placed in the traumatic surgical ICU at Temple Hospital, and I loved it. And I loved seeing a good majority of their patient population there was patients who were like trauma to the brain. And I found it very interesting how they were treated. I really liked all the devices they used. There's really cool drains and bolts that they do for neuro patients. So once I was able to interview at Penn's Neuro ICU, I got to see it firsthand, and that's when I really fell in love with it, and I really enjoyed working with the neuro patient population.
Oh, that's cool. So you did clinicals at Penn?
So I did clinicals at Temple Hospital, and
Mhm.
then I knew I wanted to work at Penn because during my 4 years of nursing school, I worked at Pennsylvania Hospital as a nursing assistant. So I wanted to stay within the Penn system, but Temple Hospital showed me like that I wanted to be in the ICU and what like and kind of veered me in the right direction.
Cool. Yeah, that's really cool. So, what's the most like critical thing that you monitor that like other people might not even like imagine is critical?
Absolutely. So, one thing we do that we monitor is ICP, which is the intracranial pressure, and that is how much pressure is in the brain. So, the neurosurgeons put in a device at the bedside. We do a bedside procedure where they put in an EVD, which is a device that we're able to drain cerebral spinal fluid from the patient's head to decrease pressure. And every hour we go in and we check the pressure of the patient's brain and we see how if we need to be draining off more fluid or not. And that is something I was blown away by. And you don't realize how critical it can be because 1 hour you can go in and the goal of an ICP is less than 20. Our patients, we flip it up. It could be 10, 12. Sometimes we go in, we flip it up, and we see it creeping into the 30s and 40s. And like immediately you have to react. And you react as a team, like you have a lot of colleagues that you go to, you get the provider, you get the pharmacist, and then with that we have to intervene with like certain medications and stuff like that. So that has been the most interesting to monitor
Oh yeah. So what happens if they have like too high
of an ICP.
cranial?
Yeah, so
Yeah.
we have two medications that we give that um, can like urgently like bring it down, but then it becomes I'm trying to think off the top of my head. So hypertonic saline is an infusion or mannitol. Those are two medications that we can push or like rapidly infuse. When we do that, that's kind of like a short-term fix. Usually it like helps the patient, but then it's more thinking like long-term, what are the providers going to do with like the drain that's in their head? Sometimes we might need to drain some more off. We also use the drain we can like raise it up and down to help um, bring off fluid off the brain. So I would say that's something like we use these two medications, but then it also helps us realize like what we need to do to keep it down as well.
Yeah, that's very cool. Yeah.
Yeah. So those two medications just again are hypertonic saline and then mannitol.
Yeah. Cool. You learn something new every
I
day.
know. I know it's crazy.
Yeah.
It's not
Uh,
something I ever like learned in nursing school, but once I started there, I was like, wow, this is something I would have never known.
right. Yeah. So how do you think neuro ICU is different from other critical care units?
I would say any small change is super critical. Uh, a lot of our patients, we assess them like how they follow commands and what they can, their pupil size, their pupillary reaction. If something changes, almost immediately we're going to a stat head scan because something can like change that quickly. I would say that's a little bit different from other ICUs from what I've seen where if they stop doing something, they'll kind of monitor to wait. However, in the neuro ICU, we know there's like a bigger problem if they stop doing like exactly what their neuro exam was prior. So a lot of our patients in the neuro ICU are Q1 hour neuro checks. So we go in and do the same exam every hour. And especially at change of shift, it's important that we go in with like the night nurse goes in with the day shift nurse because there's a lot of changes sometimes at change of shift if like you do an exam a little bit differently. So we want to make sure our patients are like consistently staying the same. So I would say the main like difference is how critical and important it is to watch out for any slight difference of a neuro change.
Yeah, cool. Yeah. So I volunteered on a uh at Jefferson's neuro ICU unit.
Nice.
It was really cool, like really
Yeah.
cool.
You loved it.
I did. It was so cool.
So what did you get to do as a volunteer?
I basically shadowed them for 8 hours and I like walked around with them and
So awesome.
yeah, I got to see a lumbar puncture and that was really cool.
It's crazy, right? Yeah, the LPs are really interesting to watch.
Yeah.
Was the patients that you saw were like a lot of them intubated or like were they awake?
Some of them were
Like,
intubated, then some of them were awake. It just depended.
it just depended. Yeah, that's like I would say that's pretty similar to how our unit is. Like some are awake, but some are also like sedated and intubated.
Yeah, yeah, yeah.
Super cool.
Yeah, thanks. How does the change of like a neuro patient versus like regular patients change your care?
I would say our care is very that's a tough question. I would say it's very thorough. Um and I would say as we're like doing just like normal like bedside care, medication administration, it's like a good time to observe the patient and see what they are doing. Um, and I would say we're just extra careful of like watching them. I know that's like a kind of generic answer, but I would say it's we're on very high alert for like a sudden neuro change because it can mean a lot of different things, such as like increased like brain swelling, a shift in like their midline. So yeah, it's super interesting.
Yeah, yeah, I bet. So can you describe a like situation where your like quick assessment of one of those patients like ended up like helping them in the long run?
Definitely. I would say I've had multiple experiences where going in, we are like intubated and sedated patients will go in and we'll pause sedation to get a true exam on them. So we'll leave sedation paused for like 10 minutes, let them kind of like wake up, trying to see what they can do. Can they follow commands, stuff like that? I've definitely had been in scenarios where we pause sedation for a little bit and we're waiting for them to wake up and we're not getting the same exam as we did an hour ago. Then we're sternal rubbing, not getting anything. We scan their pupils, they're becoming sluggish. So we know there's like a problem very quickly. So immediately, like what I do and what I have done is you get the provider, you go on a stat scan, and then we've had situations where we go to that stat scan, the provider reads it, and they're a hot case to the OR for to be like have a washout because they have like an infection in their brain. So I would say that's happened quite a few times where you notice something immediately, you react to it, and then you're able to get them to the OR quicker.
Oh, wait, that's so cool. Yeah.
Yeah, you really feel important when that happens.
Yeah, yeah. So as far as I know, neuro ICU nurses have multiple patients over one shift.
Mhm.
How do you prioritize care or manage care with patients with like different complex issues?
Definitely. So, fortunately, on my unit, we get assigned two patients at the beginning of the shift. If they're very critical, it'll be a one-to-one assignment. However, like throughout the day, it can be like you discharge and then admit. So then you're kind of like seeing multiple patients throughout the day.
Hmm.
I would say always prioritizing like going to see the sicker patient first. I always like to start off my day with like who was more recently admitted, what drips are they on, what are we watching for. So it's really important to like monitor their blood pressure, looking at their labs, seeing what devices they have that like they're connected to, if they have an arterial line, an EVD, stuff like that. So I like to prioritize by seeing who needs like the most immediate attention, usually based off their vital signs, as well as who is a more frequent neuro check. It is tough. Sometimes both my patients are Q1 hour neuro check, so then you kind of just have to go from there. Usually they try to give you a little bit someone who's a little bit more stable paired with a very sick assignment. So I would say based off of their vital signs, their blood pressure, what drips they're on, if they're on any pressors to maintain their blood pressure or any sedation, that's like usually how I prioritize, and then I go from there. And like also my first initial assessment of each patient is usually a good indicator of who I'll be like focusing on initially in the morning.
Yeah, yeah, yeah. Yeah, that's really interesting, like to do that pattern.
You
A lot
have
of
to be
critical
like
thinking.
it's a quick decision in the morning, and usually like the night shift or like the nurse passing on to you can give you a good indication of maybe who you should focus on and who the sicker of the two is.
Okay, yeah.
Hmm.
Good to know. Noted.
Yeah.
Yes. So after a shift, how do you like decompress or like take off all that stress from a
Definitely.
12-hour nursing shift?
It's tough. I would say I'm very lucky to have such supportive coworkers. Um, we usually all like at least like a group of us are leaving together. And I find that very helpful because you can chat on your way out, and by the time you get to like your car or the bus, it's done. And it's nice to talk about your shift and what went wrong, what could have been better. So I love like decompressing with my great coworkers. I think coworkers make a world of a difference at a job.
Hmm.
And then coming home, it's hard. Like I think about like certain patients for a little bit, but I can't let it like overwhelm me. Like,
Yeah.
I do like to share good stories. Some days I'm like super sad. Um, my mom's a nurse, so I'll tell her what happens. But then again, I like to take care of myself. I realize like after being in the hospital all day or all night and seeing these patients that I'm so lucky to not be in the hospital and be sick. So I try to do stuff like I exercise, and that really like helps me like decompress, I would say. And
Mhm.
also just laying in bed when I need to, when I'm tired.
Oh yeah.
Guilt free.
Hmm.
I used to feel super guilty about it, but now I'm like, you can't. You literally
Oh
need
yeah.
to relax.
You have to get that rest.
Yeah. Yeah, I feel like I stopped like overbooking myself and like trying to do so much because it's an exhausting job, that's for sure.
Yeah. On a similar note, how do you combat like fatigue and all that stuff? Because it's like a not only an emotional tolling job, also very physically
Physical.
tolling as well.
Definitely, I would say that's something I learned pretty quickly, especially like being a nursing assistant prior to like having this job. I didn't realize how much like physical like stuff I was gonna have to do. My body was exhausted even before becoming a nurse. I was like, oh my gosh, I don't think I can do this. I would say first I learned that that isn't going anywhere, so you have to be really smart at work about like how like you're physically doing things, like using like the lift, using coworkers, like not doing stuff alone. I've seen like a couple of my coworkers my age like try to do turns and pulls and pushes and end up hurting their back. So I've
Hmm.
learned it's not worth it like at all. if you don't have somebody to help you pull them or turn them and your patient looks horrible in bed, like then so be it. You have to wait. Um, but I would say taking the time, like taking a day off throughout the month, like is important. Like we do have the time, and sometimes you need like a mental health day, which I think is super important. And sometimes if you're working so many in a row, you're like, you know what? Like when you're planning your schedule, I always think it's super important to like put in like maybe this week I'm only working 2 shifts. Like you need the break, which
Yeah.
is very helpful. So, and I would say like finding like a good regimen of like how you like to stack your schedule so you feel like you're getting enough rest in between. Because 3 in a row people like it to get it over it with. I find it very difficult to like keep my body like doing that 3 nights in a row.
Yeah, because you gotta like wake up like super early.
Yeah, and it's exhausting.
Yeah.
But it's a good job, so I can't complain.
Yeah. Off of that, actually, what makes you keep coming back to
To the
the
job.
ICU?
I would say one, my coworkers keep me coming back. Super supportive. I think it's really important to have it. It's team nursing 100%. You need to have a good team there. But I would also say the patients. I love seeing patients get better, especially in the neuro ICU. Most recently, I had like a young male. He was 19 and he was super sick when I had him. I had him for a long stretch of shifts. I came back. He got downgraded to our step down unit, and the parents came over to find me so I could go back and say hi to him. And it really just made me so happy. And I felt so lucky to like go and talk to him because when I was taking care of him, he was intubated, sedated. There was not a lot of like, we didn't know what was going to happen. So seeing him get better, which sometimes our patients don't always get better, but seeing him get better, I was felt so hopeful that everyone else does too. And for being so young, I like couldn't believe it. Like I was so happy. So I would say the patient outcome really keeps me coming back, and I love taking care of people. I really do.
Yeah, that's what I hear. That's a really good trait in a nurse.
Yeah, it's you have to love it, otherwise it's really difficult.
Yeah, yeah. So I have a couple more questions.
Yeah, yeah.
Um, so for like new graduates or other nurses who are thinking about doing neuro ICU, what would you like give as advice or like recommend?
Definitely. I would say if you're gonna go into neuro, I would definitely um look into it first. It's a very niche position. However, if that's what you end up liking, like you'll love it. Um, and I would say like be ready to pay attention to detail and be very like yeah, detail oriented is like a great factor. Like be compassionate. Um, and I would say a lot of the job is not only taking care of the patient, but the family as well. It's tolling, but you need to be prepared to not only care for one person, but the rest of like their loved ones. So yeah, that's what I would definitely say shadow first and um have like I would say have good interest in the brain and neurological conditions, stuff like that.
Hmm. Yeah, and what do you wish you knew before stepping into that role?
I definitely wish I knew more about the families.
Hmm.
I don't think I was prepared to have like such difficult conversations. Like it's not always on the nurse. And but you can't always get like the doctor or the provider like right like
Hmm.
to help facilitate conversations. So that's something I would definitely I wish I learned a little bit more so I could give better answers. Um just like how to talk to family members, I would say.
Hmm.
It's
Yeah.
really difficult when they're like, have you ever seen this before? Just be honest. Are they going to make it? And it's like, okay, like I can't tell you that. I'm like, don't.
Right. You're
um,
like,
yeah, I'm like,
I
I
have
don't.
no idea.
Yeah, I'm like, well, I was like, I can go get the doctor. We can talk about this more. But they're like, but just tell me. Just tell me, are they going to make it? And I'm like, I don't know. Like, everyone's different. I don't know.
Yeah,
It's
yeah.
like, and like, I don't know. I'm not the most convincing face. Like, I look like I'm in my like I'm 25, like they're probably like, oh, we don't want to hear it from you. And I'm like,
Yeah.
oh.
Yeah. How do you stay objective versus like not letting your emotional side take over in those conversations?
I always like go back to like the facts of like the patient. I'm like, well, if you see like look at them now, like look how much they've improved, or look what they're doing now. Like let's focus on that and see how this progresses in the next couple of days. Like I try to just make it very like specific to like their loved one. Like I don't like compare to anyone else. I feel like it's super important just to like keep the family member focused back on their like on that loved one and show them that they're making good progress until they're not. And then it's appropriate for like the doctor to come in and talk about it and everything.
Yeah.
Yeah, so
Um, I know
yeah.
you've only been in this role for like almost about 2 years.
Yeah.
So I'm not sure if this question is applicable, but like how have you seen like critical care and stuff like that change during your career, including nursing school?
Yeah, that is so interesting. I would say like the technology is making it like better in a way. I feel like there's a lot of like for example, Penn is or like one of like the first hospitals in like Philadelphia to have the pupillometer. So I feel like the pupillometer measures like the size and reaction of the pupil instead of like doing like the pen light because that's like very like subjective to a person. Like
Hmm.
oh like three and brisk I would say, but the pupillometer like actually measures it. And when I first got to my job, like they didn't have that at Temple. So I was like amazed to see how like stuff that is so important is like getting more and more like defined and like regimented. So I thought that was really interesting. And I think it's getting a lot better. I think like like they're finding new things for everything. So I would
That's
say it's getting
actually,
better.
yeah, that's really cool.
Yeah, I couldn't believe it. And like talking to like other people, like they don't like a pupillometer. Like it's unbelievable. And like so quickly, like the pupils are the first to go for like you're losing your brainstem like your cough, your gag, your corneal. So it's like super important to catch that early on so we can like the doctors can intervene and the surgeons.
Hmm.
So I've been like amazed to see that because sometimes you'll scan their pupils and they're non-reactive and like you're like, oh my gosh, this is an emergency. So been very helpful.
Yeah, yeah, I bet.
Because
Yeah.
like you don't like always trust like your pen light, like, oh, it looks like it's three and brisk. I think it shrunk. I hope.
I don't know.
Yeah,
Yeah.
exactly. I'm like, I don't know.
Yeah. And for my final and last question, what do you think future neuro ICU nurses should be like prepared for?
Wow, that is a great question. I would say I feel like more like unfortunately people are doing more like I don't know, daring things like I don't know, especially as like the weather gets nice, or, like just stuff like that. I think there's gonna be like a lot more brain injuries and traumas, so that's always like cautious to be aware of, and they need to be prepared for I don't know, maybe like advocating for like neuro like brain safety, I would say, and looking out for I would also say it's important to advocate for like teaching like the community about like what are like signs and symptoms of a brain bleed or something like people like so they can get to the or stroke so they can get to the hospital sooner. I think like it's only going to get worse like just with like as people are exposed to like nicotine and smoking like I and like obesity like I just think like there's going to be a rise of strokes and um neurological problems. So I think it's important to start teaching people about it now so they know when to go to the hospital before like it's kind of too late.
Yeah.
Which is like
Great.
sad, but it's true.
Yeah.
Yeah.
Well, thank you so much for interviewing with me. I had a great time and I learned so much.
My gosh, of course.
Thank you.
All right,
Bye.
bye, Kate. Have a good night.
You too.